Hello everyone, welcome back to my YouTube channel, Dr.Barki's Ophthalmology Tutorials. With this video, we'll start with the diseases of orbit. To begin with, we'll start with the inflammations of orbit. Okay. So it is important to know about the inflammations of the orbit because most of the time, the primary foci of inflammation is elsewhere. Like it can be a systemic disease, it can be a neoplasm, it can also be from the surrounding structures like skin or the sinuses, or it can be within the orbit. So it is very important to know the primary cause for the inflammation of the orbit. And unless you treat the primary cause for this orbital inflammation, the inflammation of the orbit will not subside. So that is one importance. The second is, if you don't treat the inflammation of the orbit properly, it can be grave prognosis for the eye. Like the patient may lose the vision because of the exposure keratitis or even the neurotropic keratitis or the optic neuropathy. So it is very important to know about the inflammations of the orbit. The diseases of orbit written by Rootman classifies the orbital inflammation into three categories. That is the orbital inflammations which are secondary to infectious etiology. The second classification is the orbital inflammation which have the local or the systemic constellation of symptoms. And the third category falls into those inflammations which have specific histopathological features. Whereas textbook of Kurana gives a simpler classification where it classifies the orbital inflammations into infective and non-infective. So the classification is like inflammation of the orbit can be divided into infective etiology and the non-infective etiology. In the infective causes, it can be acute presentation or it can be because of the chronic disease. In the acute, we have what is known as preseptal cellulitis, orbital cellulitis, even the cavernous sinus thrombosis. Whereas in the chronic diseases which present with the orbital inflammation are the tuberculosis, syphilis, the fungal infections like mucormycosis and even the actinomycosis. If you come to non-infective etiology of orbital inflammation, it can be just isolated disease confined to the orbit or it can be associated with a systemic disease. So the isolated diseases which are confined to orbit are idiopathic orbital inflammatory disease, secondary to inflammation of the muscles, that is the myositis, or even secondary to dacroadenitis, that is inflammation of the lacrimal gland. When the orbital inflammation is associated with the systemic diseases, it can be secondary to the thyroid eye disease or the vaginous granulomatosis or secondary to sarcoidosis. So this is the simpler classification for inflammation of the orbit. So now in this video, we will just concentrate on the infective etiology, in that again the preseptal cellulitis. So in this video, we will discuss about the causes, presentation and even the management of preseptal cellulitis. Without much delay, let's begin our video on preseptal cellulitis. So coming to infective etiology of this orbital inflammation. So the infection to the orbit can spread from either the skin or even the sinuses or the oropharynx, even if there is a foreign body in the orbit, the pymic infection. All these can lead to the infection in the orbit. Okay. So Chandler et al. Gives a classification for infective orbital inflammation, which includes preseptal cellulitis, orbital cellulitis, subperiosteal abscess, orbital abscess and cavernous sinus thrombosis. Most of the time, the disease process will go in this sequence. Like initially there can be preseptal cellulitis which can spread into orbit leading to orbital cellulitis. There can be periosteal abscess or orbital abscess and cavernous sinus thrombosis. But sometimes there can be variation in the presentation, like the patient may suddenly present with orbital abscess or suddenly he may present with a cavernous sinus thrombosis. Like in case of acute pressure blowout from the sinuses, the patient can suddenly present with the subperiosteal abscess or even the orbital abscess. And if there is an infection in the sphenoidal sinus, it can directly lead to the cavernous sinus thrombosis. And if there is inappropriate treatment, patient may have varied presentation. So now we will start with the preseptal cellulitis. So this preseptal cellulitis can be asked as your 5-mark question. So write the opening statement as it is one of the orbital inflammatory diseases. You can define this preseptal cellulitis as infection and inflammation of the structures which are anterior to the orbital septum. To understand where exactly the orbital septum is and where the inflammation occurs, you should know the anatomy first. We have a video on anatomy of eyelid. I have given the link in the description box. Please do watch that video. Then you will understand this preseptal cellulitis in a better way. So that is the definition, that is inflammation of the structures which are anterior to the orbital septum. So from where the infection will occur into this preseptal space. So modes of infection are from either exogenous or from the surrounding structures or from the endogenous. So from the exogenous, we have the infection or the inflammation which are affecting the skin, okay, skin like the skin laceration or the insect bite or even the eyelid surgeries. So all these can lead to the preseptal cellulitis. Then we have local causes like acute dacroadenitis. This can also lead to preseptal cellulitis. In the endogenous causes, we have the infection which can spread from the middle ear or even the upper respiratory tract infection. So these are the various modes of infection leading to preseptal cellulitis. To repeat again, the skin, we have laceration of the skin, insect bite, eyelid surgeries, and even there can be external hardiolum or the acute dacroadenitis. The infection can spread from the middle ear or the upper respiratory tract infection. Which are all the organisms which can lead to preseptal cellulitis? It is usually Staph aureus or even the Streptococcus pyogenes, or it can be H. influenza. Okay. So these are the three main causes for preseptal cellulitis. So what are the clinical features of this preseptal cellulitis? Patient can present with eyelid edema. It can be erythema or hyperemia of eyelid. Okay. There can be pain in the eyelids, and even patient can have the systemic features of fever or the malaise. This symptom may or may not be present always. So this is how the patient with the preseptal cellulitis will present along with the precipitating causes which I mentioned just now. So more than knowing what is present in the preseptal cellulitis, it is important to know which symptoms are absent. The symptoms which you should concentrate are like vision, proptosis, ocular movements, and even the conjunctiva. So if all these are normal, like vision is normal, there is no proptosis, ocular movements are full, and conjunctiva is looking normal, then you are on safer side. The patient is having only preseptal cellulitis. If these symptoms start presenting, then the patient may be going into the orbital cellulitis, which is little dangerous compared to your preseptal cellulitis. So always look for these symptoms when you are examining a patient of preseptal cellulitis. So coming to the management of preseptal cellulitis, the diagnosis is usually clinical. There is no need of any investigations as such. So the treatment is, should treat with the antibiotics as well as anti-inflammatory drugs. The antibiotics usually include the amoxicillin acid, 100 mg dose TID for 5 days. Then if the infection is very severe, you can go with the IV ceftriaxone to 2 grams per day in the divided doses. You should also supplement this antibiotic with the anti-inflammatory drugs to reduce the inflammation and the lymphedema. Then you should also advise patient to do warm compresses, which will give symptomatic relief to the patient. And surgical exploration in the drainage is needed if there is a mass or the abscess within the eyelid. So this is about the treatment of preseptal cellulitis. In this video, we studied about what is orbital inflammation, why it is important to know about the orbital inflammation, what is the classification given by Rootman as well as Kurana, and the preseptal cellulitis in detail. That is, preseptal cellulitis we studied under the headings of definition, causes, organisms which are causing the preseptal cellulitis, clinical features, and the management. So hope this video on preseptal cellulitis and the orbital inflammation is helpful to all of you. If you like my videos, please do subscribe to my channel. Press the bell icon for further notifications. Please do like and share my videos and leave your valuable comments. Thank you so much.